The doors are always open. The clock never stops. It's the life we have chosen. Or did this life choose us? It's a challenge to look in the mirror and see how others see you. It's a qualification to be here. To recognize the power each of us has every minute of every day to make a profound difference in someone's life. We remember you, almost every one. We want you to remember us. For the next several minutes, spend the day with us. Meet some of the people who know you count on them. We're humbled by the trust you place in us, and we're proud of each other for rising to meet that responsibility.
If it's a girl, it's Olivia. And if it's a boy, it's Tucker.
There we go. All right.
Oh, good.
Woo! It's Olivia.
This is our hospital for Aiken County, and it's a good one. It's one we can be proud of. Every day is a miracle. Every birth is a miracle.
Teamwork is the most essential part, especially in this specialty area, the intensive care unit. We have a lot of complicated cases here. You have to react quickly. The people here that I work with, they're more like a family to me. It has to be coming from you, from the heart. That is part of the culture. That is very rewarding for a nurse like me.
In the ICU, it's super fast-paced often. You have to really know your stuff, but it does take something from within. You have to dig deep sometimes. It's nice to come to work and know that you're working with people that you love and people that you care about and people that care about you. It means the difference between a really good nurse and a really great nurse.
Coming from a very large city, all my rotations were in New York City, in the different boroughs. The difference between a large university hospital or a large, institution. Here, I found people actually have the interpersonal relationships with each other. I think it allows a more personal care. And that's not something that you see at other facilities. I think it's a fine balance.
Hospital medicine is very different than outpatient medicine. It's very busy, it's very fast-paced, and patients are very, very sick.
How's this youngster?
We choose Aiken Regional. We choose a small place because we want to be a part of the community. We want to know the nurses by name. We want to know our patients. We want to know their families. I think that translates into much better patient care. The people I admire the most are the people who care the most.
There's little hindrance to advancements in medicine here. Just because one hospital is larger than the other, that you receive superior care is just wrong. There are endovascular procedures that have been performed in this hospital for years before they were performed across the river. It's a smaller hospital. To me, I think that's a benefit to patients.
I'm a cardiothoracic surgeon that also has a second practice in vein surgery. The number one profession I see for sure are school teachers. People that stand on their legs all day long on concrete or tile floors for 30 years. We can do something about this. The swelling goes away, the discomfort goes away. That's rewarding to me.
I see patients relatively frequently who come to me and they are uniformly terrified. Number one, the terror of not knowing what's in your brain, and number two, you're going to see somebody who operates on the brain. To help them cope both with the reality of the diagnosis and the necessity of the treatment, the art of neurosurgery is the interaction the neurosurgeon has with the patients and their families.
It could be an intimidating environment. They can get lost. Who do you talk to? We have this badge that we wear that says, "Ask me," because we want to be approachable. Somebody that's willing to see that you're in a little distress and you're able to walk up to them and help them out. Hey, Trevor Razor, I'm a respiratory therapist.
I grew up playing almost every sport, so it was a natural fit for me to want to be in sports medicine. Half the basketball team is from over 500 miles away, so you know, this is their family, this is their community, and I think it's reassuring to the coaches and to those kids' parents to have a doctor around that can help them if they need it. It's neat, especially when you know those kids and you know the work they put in and the practice and you know, the time in the weight room and the training that they do. It's fun to watch them persevere through an experience like that, and especially it's fun to watch them win.
The day's not done. When the clock strikes midnight, it keeps running. A nurse starts an IV, a family member sits up late, someone is looking for the nurse's station, and a baby is born. Each has that one person, backed by 1,000 others, who sees in themselves the power of one.